Welcome back to another NCLEX question of the day. This time we are covering a high-risk endocrine emergency, thyroid storm, also known as thyrotoxic crisis. This life-threatening condition occurs due to excessive thyroid hormone release, leading to severe cardiovascular and metabolic instability. Understanding how to prioritize interventions in thyroid storm is crucial for the NCLEX and real-world nursing practice. Let's begin. A 42-year-old female with a history of Graves' disease is admitted to the emergency department with severe agitation, confusion, and profuse diaphoresis. Her vital signs are as follows: blood pressure of 160/88, heart rate of 148 beats per minute, irregular respiratory rate of 28 breaths per minute, temperature of 39.7 degrees Celsius or 103.5 degrees Fahrenheit, oxygen saturation of 97% on room air. The nurse suspects a thyroid storm. Which of the following interventions should the nurse implement first? Option A, administer intravenous propranolol to control heart rate. Option B, administer intravenous PTU, also known as propylthiouracil, to block thyroid hormone synthesis. Option C, initiate cooling measures such as ice packs and a cooling blanket. Option D, administer intravenous dexamethasone to block peripheral conversion of T4 to T3. Take a moment to think about your answer. The correct answer is administer intravenous propranolol to control heart rate. This patient is in thyroid storm, a life-threatening emergency caused by excessive thyroid hormone release. The most immediate threat is severe tachycardia with a heart rate of 148 beats per minute, which increases the risk of high-output heart failure and cardiovascular collapse. Beta blockers such as propranolol are used to reduce heart rate and myocardial workload, control hyperadrenergic symptoms like tremors and agitation, and lower blood pressure, though this is not the primary goal. Propranolol also inhibits peripheral conversion of T4 to T3, helping to reduce thyroid activity over time. Now, let's look at why the other options are incorrect. Option B. While PTU is a key medication in thyroid storm, it is not the first priority. It does not work immediately and takes hours to lower thyroid hormone levels. The patient is at immediate risk of cardiovascular collapse from severe tachycardia, which must be addressed first with propranolol. PTU is given after stabilizing the cardiovascular system to block thyroid hormone synthesis and prevent further exacerbation of hyperthyroidism. PTU would be the first priority if the patient were stable with moderate tachycardia, but not in immediate cardiovascular distress. Option C. While hyperthermia is common in thyroid storm, it is not the most life-threatening issue. Cooling measures do not fix the underlying cause and only provide symptomatic relief. Uncontrolled tachycardia and high-output heart failure are the immediate life-threatening concerns. Cooling measures should be initiated after cardiovascular stabilization. Cooling would be a higher priority if the patient had a critically high fever above 41 degrees Celsius or 105.8 degrees Fahrenheit that risked organ damage. Option D. While dexamethasone reduces thyroid hormone effects, it does not work immediately to stabilize the patient. The primary concern in thyroid storm is cardiac instability, and propranolol addresses that faster. Corticosteroids are used later to reduce inflammation and decrease T4 to T3 conversion. Corticosteroids would be prioritized in cases of severe adrenal insufficiency accompanying thyroid storm. Key takeaways: cardiovascular stabilization with propranolol is the first priority in thyroid storm. PTU should be given after cardiovascular stabilization to reduce thyroid hormone synthesis. Cooling measures are helpful, but not the immediate priority. Corticosteroids play a role, but are not the first-line intervention. Did you get the answer right? Let us know in the comments. If you want expert guidance on test-taking strategies, book our crash course for step-by-step breakdowns of high-yield NCLEX topics, test-taking techniques, and priority interventions. We have multiple dates and times available at NCLEXsage.com/NCLEX Crash Course. Share this video with a fellow nursing student and subscribe for more NCLEX questions and explanations. Thank you for watching, and see you in the next video.